Okay, so we'll be talking about the embryological basis of renal agenesis. Okay, so renal agenesis is an abnormality in the development of the what? Kidneys. All right, so you can see here that this one totally there's no kidney. This one there's no kidney and the ureter at that side, and that's the main thing they call agenesis, right? These ones there are other types. Hypoplasia, there's the kidney, but the kidney is abnormally small. Aplasia is when there's a ureter there, but the kidney is not there. All right. While agenesis, the kidney and the ureter are not there. Do you understand? So the embryological basis is like you looking at when the child was developing, what was the abnormality that had occurred for this kind of situation to actually surface, right? So we'll just talk about the embryological basis. Then I'll still take time to teach you guys about renal agenesis so that for everybody, anyone who wants to know about renal agenesis, you can just take this period to know. So, abnormal development of the kidney can lead to what? Renal agenesis. And the possible things that lead to renal agenesis include failure of ureteric board formation or branching. That's the main cause, right? Or abnormal metanephric blastema differentiation. All right. So I want you guys to just work with these two. All right. Work with these two. You can put the first point or say or then put the second one. All right. Either one you should get it because you want to now you don't know there are different causes but you don't know what is in a marking scheme. So at least you want to know like two so that you try your best, right? So now let's talk about renal agenesis in the large this thing now. We see that renal agenesis, also known as what kidney agenesis or renal aplasia, has its embryological basis in the abnormal development of the kidney during embryogenesis. So now you want to know the development of the kidney, which is from the pronephro formation, which is at the third week. We said that the pronephros, which is a non-functional kidney, forms during the third week. The mesonephros formation is between the fourth to fifth week. The mesonephros, which is like a temporal kidney, develops. Then that's mesonephros, right? Then metanephros formation. So that the metanephros is like the permanent kidney, forms from the interaction between what? Metanephric blastema and ureteric board. So now, okay, I think the third point too is valid, where there's insufficient interaction between ureteric board and metanephric blastema. But this one of talking about genetic mutation, leave it out. Don't say anything about that, right? Because we're asking you about during development, what are the abnormalities? So genetic is not part of it like that, right? So you can work with those 3 points right there. So types include unilateral or bilateral or renal hypoplasia where you're having an underdeveloped kidney, right? The clinical presentation, there will be flank mass or asymmetry. If you check the two kidneys from probably an imaging test, you see that maybe one kidney is there, one is not there, or one is there, the other one is too small, all right? There'll be hematuria, the person will be urinating with blood. Proteinuria, the person will be urinating with what? Proteins in the urine. So you see the urine looking like whitish, you know what I'm saying? Looking like whitish, be foamy, all right? Then renal failure, then hypertension. If you want to confirm that there is a kidney agenesis or renal agenesis, you want to do ultrasound, CT scan, or MRI or genetic testing, right? Treatment, dialysis, right? Because the person is not having sufficient, okay? Then supportive care too, right? So I think that's it for the embryological basis for renal agenesis, kidney agenesis, or renal aplasia. We spoke about the embryological basis where I said that you guys should work with these first 3 points. Then we still spoke a little about the situation so that at least what you are writing, you know something about it, okay?